Good afternoon, dear colleagues, and today we continue with the second part of our course. Its goal is to explain how clinical data can be used to answer research questions in order to improve the health of patients and the population in general. We will consider the following questions. How to choose relevant research questions. What is the structure of healthcare system? How and what data is generated about patients? Different types of data, an overview of methods of processing and analyzing data that give us answers to the questions posted in this topic. And we will check the problems about biases that may arise and how to solve them. And to do so, we will need to follow some basic steps in data mining workflow. First of all, we will need to describe important categories of research questions. A list of properties that make the research questions useful. In this course, we will use the concept of data mining, which consists of 4 stages. First of all, ask the research question. Next, identify one or more data sources that might contain an answer to a question. Extract and transform the data into the form you need for analysis. Conduct an analysis using this data. Once the steps have been completed, the results are evaluated and then the process is repeated if it is necessary. In this section, we'll focus on the following 2 views of medical data. First of all, it will be patient's chronological scale and patient feature matrix. And as an example, we will focus on some prototype for a patient. Let's name her Lisa, and she's an adolescent with a chronic condition called systematic lupus, and with exploration of this condition and the development of proteinuria, pancreatitis, as well as the presence of antiphospholipid antibodies in the blood. There is a risk for blood clot formation in such patients. So we will ask this question as an example. Should an adolescent with this condition who develops proteinuria and antiphospholipid antibodies take anticoagulant drugs? We have formulated a clinical question here, and let's think about what to do with this question, how we can go with a good answer for it. So now we're moving to the next step of the workflow. We will need to identify data sources. To do this, we will need to study the medical literature, learn the past experiences, we will need to consult the experts, and one approach is to study what has happened to similar patients before, using all the relevant data that appears in the electronic health records of large medical center. So this EHR data isn't necessarily organized in the way that makes it easier to search data in this stockpile of information. Medical expertise is required to correct diagnostic codes and medical terms to identify patients in a similar situation. So we will need to have several steps to search this data. First of all, we will need to identify the right group of patients. Among all patients in the medical record system, we will need to find those who are monitored by pediatricians. And it will be a request based on the patient's age. Next, we'll use diagnostic code of lupus to find patients with proteinuria by checking the values indicated in the urinalysis. And we will need to find patients with antiphospholipid antibodies in this dataset. So we will need to check lab tests. The results can be written in numerical form. If the results are presented in the text document, we will need to look for some terms which are related to the situations. For example, aspirin treatment as a proxy marker or something like that. And we will need to confirm the search results by checking the laboratory results for the presence of antibodies in those patients whose test results are available in the searchable form. So in the middle of this process, we will need to define the criteria that will allow us to identify the corresponding group of similar patients. So the problem we are interested in is blood clotting. Based on the knowledge of the clinical expert, we will search for terms, again relying on the clinical expertise when choosing these terms. So these terms will be thrombosis, blood clot, and so on. Next, we will need to compare the risk of blood clotting in adolescent with lupus and proteinuria and antiphospholipid antibodies with a baseline risk of clotting in adolescent with lupus. We need to get the patient's data from the EHR system in the form that allow us to perform an analysis. It was found that the relevant relative risk of thrombosis formation, the presence of proteinuria and antiphospholipid antibodies was twice as high compared to the baseline level. Respectively, it was decided to treat with anticoagulant. Therefore, you have completed step 4 of the data mining workflow. Let's present the information in the form of a chronological scale of the patient. We start with data collected by the healthcare system, in this case the electronic health record, which include diagnostic codes, lab results, drug orders, and text notes written by doctors. And next we organize this data on a chronological scale, one for each patient, and then identify patients seen by pediatricians as well as patients with lupus, some of whom develop comorbidities such as proteinuria, antiphospholipid antibodies, and we use a chronological scale to count which patients experienced blood clotting after they developed each clinical condition. So we will identify that these facts are happening one after another. We then calculate the proportion of people with each disease who develop blood clots in order to get relative risk values. So let's briefly introduce our data mining workflow. What was the clinical question? Is the risk of blood clotting high enough in adolescent with lupus, proteinuria, and antiphospholipid antibodies to be treated with anticoagulant? What is the source of this data? It was electronic medical record. What exact conversation steps and conversion steps did we take to follow the track? We determined how we would search for adolescent with these conditions and how we would identify subgroups based on clinical conditions. In some cases, this involves the data used in the form of diagnostic codes and the use of medical knowledge to search for the right terms. So we will need expert knowledge here. In one case, we use a proxy term in our search to follow as a step-by-step process, updating our knowledge. Finally, we compared the risk of blood clotting in the subgroups with the risk of blood clotting in adolescent with lupus in order to decide do we need this treatment or not. In this example, we used a single data source as electronic health records. It's important to remember that there are no perfect ways to do all of the steps, and for each situation we will need to adjust them to perfectly match this situation. And of course, we will need experience in doing so to make it work better and better in each iteration. It's better to think of the entire data mining process as something that should be done with the help of an experienced person or expert, rather than an automatic algorithm that provides an answer without knowing the broad context of the situation. So we asked about the treatment of Lisa, who was experiencing a number of clinical conditions. However, the question we answered concerned the proportion of patients with a set of clinical conditions who developed blood clots. We have answered a question about baseline and quantity of the proportions of this patient. So we need to make an assumption what happened earlier with these patients, and is it likely to happen to Lisa and other patients in this condition. The assumptions and the resulting conclusion will give us a risk stratification for this situation. If we conclude that Lisa is at a high risk, we will understand that this treatment is clearly necessary for her, so we will have no doubt in this. So in real life, we will also need to draw similar conclusions about the risk of adverse outcomes as a result of treatment before making a final decision. So we can name several types of research questions. In data mining, we can formulate different kinds of questions. All these questions can be divided into the following categories. A descriptive question, a question that requires data synthesis, question research, a question that requires you to discover any patients that might exist in the available dataset. It's another type is a logical question, find patients that go beyond the specific available dataset. The goal is to discover knowledge that can be generalized. Next one is prognostic question. What is the quantitative relationship between some characteristics and the outcome of interest? Next one is case and effect question. What is the effect of changes in one variable on the second variable? Next one is a deterministic question. It's a question that goes straight to the basics. clinical data is best suited for answering descriptive, exploratory, logical, and predictive questions. So we always ask questions to achieve two main goals. It will be risk stratification for treatment decisions and data-driven treatment selection. So we will need to decide, do we need treatment at all, and which treatment is the best for the patient. We asked about the treatment for Lisa, who was experiencing a number of clinical conditions. However, the question we answered was about the proportion of patients with a set of clinical conditions who developed a blood clot. We answered a descriptive question based on quantity and proportions. We then need to make the assumption that what happened to these patients is likely to happen to Lisa as well. The assumption and the resulting conclusion give us a risk stratification. So, if we conclude that Lisa is at high risk, it will be clear that treatment to offer her, namely wherever to use these anticoagulants or not. So in real life, we will also need to draw similar conclusions about the risk of adverse outcomes from the treatment before making these decisions. So these decisions could be generalized and not used as a single person decision each time. What makes the question to the answer useful? So first of all, it will be how many patients were affected. What is the burden of the disease? What is the likelihood that the results will happen and will have a beneficial effect on this target community? What happens as a result of answering to this question? Will anything improve if we will find the right answer to this question? Does knowing the answer will help more than one component of this group of the patients? For example, only healthcare providers, only patients, or maybe only payers. So these questions we will try to analyze in our next lectures. For today it's all. Thank you very much.